Let's take a look at the spinal cord in cross-section. So we've already looked at the overall spinal cord, but we want to look at cross-section to get some more details of things. Now I've already gone through the three meninges, but let's look at them in the cross-sectional view. The dura mater is the most external piece. It's what's outside around here. Now that dura mater, again, is strong, protective. Just inside of it, now you can see that there's a little ledge there. This is going to be the arachnoid mater. So you have the dura mater and the arachnoid mater. Very close because that subdural space is only a little film. So it's a thin film in there and that's it. Pia mater we know is like saran wrap. It wraps tight around the spinal cord. So this line, this white going around, all the way in and out, that is going to be the actual pia mater. So it's like a saran wrap wrapping around into every nook and cranny of the spinal cord. Epidural space. This one is not in the brain, remember. It's unique to the spinal cord. You can see this epidural space here, this whole thing is filled with adipose. The yellow is adipose. You also have plenty of blood vessels located throughout that. So that's the epidural space. If that name's ringing a bell, maybe think of epidural injection from a woman in labor. The epidural injection goes into that space, and that's where the injection actually is, the epidural space. Subdural space. Subdural is just a thin film, so there's not a lot of space here. It's just this little edge in between the dura mater and arachnoid mater. So it's a very thin film at that point. This subarachnoid space, well, that's more. This all is subarachnoid space, here, down here, around here. The subarachnoid space is going to be filled with cerebral spinal fluid. So it allows the spinal cord to be completely encapsulated in a fluid environment. So just like the brain, the subarachnoid space of the spinal cord is going to have cerebral spinal fluid, or CSF. We then have this anterior median fissure. Remember, fissure is a deep indent. You can see this fissure goes all the way in down to there. So the anterior median fissure is found obviously on the anterior side, but then the posterior side, we have the posterior median sulcus. Now the posterior median sulcus isn't nearly as deep of an indent. So the posterior median sulcus. Now, if you're trying to think of how do you keep it straight, anterior median fissure, posterior median sulcus, A and F are both earlier in the alphabet, then P and S. So anterior median fissure, posterior median sulcus. If it helps, great. If not, I've got other ones. So that is the posterior median sulcus. Now I kind of zoomed out a little bit here. This is still in cross-section, but you're seeing the entire vertebrae as well. So we're looking at the dorsal root ganglion. That's this structure right there. It's the larger bulge. The reason being, the dorsal root ganglion is going to house the sensory cell bodies, or the sensory soma. By housing the cell bodies, it needs a larger space because the cell bodies are larger than the axons. So that's the dorsal root ganglion. We then have the ventral root over here. Ventral root, you can see comes off right here, then goes right next to the dorsal root ganglion. So that is the ventral root. And then we have the dorsal root as well. The dorsal root comes off of the dorsal root ganglion. Now, the dorsal root and ventral root are unidirectional as far as flow of information. The part right back here, right where they join, that's the spinal nerve. That's bidirectional, has both sensory and motor. But then once we get to the dorsal root ganglion and dorsal root, the information is only traveling in one direction. The dorsal root and dorsal root ganglion are traveling into the spinal cord, so it's sensory, while the ventral root is traveling away from the spinal cord, so it's motor output. So we have unidirectional flow here. Dorsal root ganglion are going to be one direction inwards, sensory, while the ventral root is coming out. So just keep in mind, that's the dorsal root, and refresh, that's the dorsal root ganglion, the larger, thicker part. All right, let's go back in a little closer. We have this gray commissure. Gray commissure is bridge. This is bridging between the right and left sides of your spinal cord. So that's the gray commissure. We then have the central canal. The central canal is going to be this little tiny circle right in the middle. That is fluid filled, specifically cerebral spinal fluid. So the central canal is filled with cerebral spinal fluid. So you have the inside filled with fluid, as well as the outside is encapsulated by fluid as well. So the spinal cord has fluid inside and out. All right, we have 3 horns. Dorsal horn, which you can see here. This is the dorsal horn. We then have ventral horn. The ventral horn is what's down here. It's all gray matter, so ventral horn. And then we have the lateral horn, which is out over here. That's the lateral horn. So now let's look at the information flow for a second. We know that the dorsal root ganglion is sending information in. The dorsal root is sending information in. That information comes in to the dorsal horn. From the dorsal horn, information will flow across to the ventral horn. From the ventral horn, it flows out to the ventral root and down out towards the spinal nerve. One direction of flow for information. Again, dorsal horn is receiving the sensory information from the dorsal root. The ventral horn is sending information out to the ventral root. So we have the dorsal root ganglion, sensory information. Dorsal root, sensory information. Dorsal horn, sensory information in. The spinal cord makes a decision or sends to the brain makes a decision, comes back down. Motor output. The ventral horn is motor output heading to the ventral root, which is motor output. So we have a one-directional flow traveling into and out of the spinal cord. So that's a cross-sectional view of several different parts and pieces of the spinal cord.